All right, welcome everyone to today's webinar by Caring.com. We're very excited to share this informative presentation with you about the latest information about Alzheimer's with someone incredible who's been with us before from the Alzheimer's Association. So welcome, Corey. As we begin, I want to cover a couple of housekeeping items for today's webinar. This is a one-way webcast, so just Corey and I will have video and audio throughout the presentation. However, we'd still love to hear from you. At any point throughout the webinar, you can submit your questions using the Q&A section or the chat. We'll be answering those questions following the presentation. One of the most common questions that we get is, will this webinar be recorded? And yes, we did that. We are recording and we plan to distribute both the recording, the slides, and some other incredible resources from the Alzheimer's Association in the next few days. This free webinar is brought to you by Caring.com. For those who may be less familiar, Caring is a leading online resource for senior living and senior care. Our organization was founded by caregivers for caregivers, and our flagship website, Caring.com, was created and launched in 2007 in order to equip family caregivers to make better decisions, save time and money, and feel less alone and stressed in providing senior care to their loved ones. I think that's even more true when thinking about those in need of Alzheimer's and dementia care. Today, we have a portfolio of websites and referral services that millions of people use to research senior living and senior care. And thousands of senior living communities and home care agencies partner with Caring to reach their target audience who are actively looking online for care solutions. One of the many reasons that care seekers turn to Caring is for our high integrity reviews program, where we have nearly 400,000 consumer reviews. We're also excited to share that we are now a participant in the Age Tech Collaborative from AARP. First, we can kick it off with some introductions. My name is Jess Hall, and I'm the Director of Brand and Creative here at Caring, and I'll be serving as the moderator for today's presentation. So excited to have Corey here with me today, and really thrilled to have the discussion around the latest insights into Alzheimer's research and care. So with that said, as I mentioned, one way, recording will be shared. You can submit questions at any point, and we will have a live Q&A. So I am going to pass the remote of sorts over to Corey and give her a chance to dive in.
All right, everyone. Thank you, Jess. And welcome, everybody. I am just attempting to forward the slides and having a little trouble advancing them. Here we go. So as Jess mentioned, we're going to spend a little bit of time today exploring the current state of Alzheimer's in our country and looking a little bit ahead at what is to come and where we are going on this journey. Of course, more than 7 million Americans are living with Alzheimer's disease in the United States, which translates to over 11 million Americans who are providing unpaid care for people living with Alzheimer's or other dementias. These are family members, these are friends, these are not the professional caregivers who often have the best of intentions, many times not the training, the knowledge of, or the access to resources and support. Every year, the association publishes an annual facts and figures report. The 2024 full report is available online. I think Jess may be putting this information into the chat for you all. Let me just go back here to highlight. Jess, it might be easier if you advance the slides for me, if you don't mind, and if we just go back one.
Sure, no problem at all. Let's see here.
Great. Thanks everyone for bearing with us just as we get the rhythm
there
of
you go.
So there we go. So again, the full 2024 annual facts and figures report is available online. It is public facing at alz.org/facts and figures. I did just want to draw attention to a couple of these data points. we will hear a little bit more about what caregivers face, but in essence, those over 11 million Americans are providing approximately 18 billion hours of care, valued at nearly $350 billion. So astronomical amount of time and cost as well. And we'll talk a little bit more about what caregivers are identifying as stress factors and needs in the journey and some initiatives to address that. Also wanted to bring your attention to lifetime risk. If we look at men and women at age 45, 1 in 10 men are on the trajectory to develop Alzheimer's disease, 1 in 5 women. Next slide, Jess. If we talk a little bit about who the caregivers are, we have traditionally thought about Alzheimer's as an older adult's disease. Therefore, we frequently think of caregivers as also older adults, as spouses or partners caring for the other spouse or the other partner. In fact, 2/3 of caregivers are under the age of 65 years old. The vast majority of them are women. They are caring for an older parent or an older relative. And then within that group, at least a quarter of them are what we call the sandwich generation. So these are individuals who are caring up for an older relative. They are also caring for a child under the age of 18. When we think about caregivers in the workplace, as the disease progresses, as their loved ones' needs increase, that requires more time of the caregiver as well as more costs. And yet the time that they are able to spend at work decreases, and therefore their sources of income decreases. When we look at challenges for employers, they are increasingly facing higher turnover rates, less of a return on investment, less productivity on the front lines. So we are talking finally more and more about the impact in the workplace of this disease. Next slide, please. Briefly touching on risk factors, genetics, family history, age are all risk factors for Alzheimer's disease. If we turn to the next slide, age remains the greatest risk factor. 65 years of age and 85 years of age are kind of markers increasing in that risk factor. Next slide, please. We are beginning now more than ever to understand the progression of Alzheimer's disease as a continuum. Traditionally, we have thought about the disease from the onset of symptoms, and we have often talked about the pathway as the mild or early stage, the middle or moderate stage, and then the severe or later stage. And so for many of us in the senior care industry, for example, we are really beginning relationships helping these families somewhere in the mild, mostly in that moderate stage. But science and research, of course, have taught us that while there may not be symptoms until much later in the disease, actual damage is occurring in the brain years and even decades before an individual becomes symptomatic. So we now recognize that there is an asymptomatic stage of this disease. And in some cases, we can pinpoint it to an individual's 20s, 30s, or 40s. There's also mild cognitive impairment, which does not guarantee a progression to Alzheimer's, but does in fact put us at higher risk of Alzheimer's disease. And better understanding this progression is really vital for the research and the science in developing treatments, abilities to slow down the disease, and ultimately to cure the disease. Next slide, please. This is also a busy slide. Again, you will get a copy of this, but further related to risk factors, we recognize those non-modifiable risk factors. I mentioned age, genetics, family history. Race is a factor as well. African Americans or Black Americans are twice as likely as white Americans to develop Alzheimer's. Hispanic and Latino Americans are 1.5 times as likely. And we cannot control or modify those risk factors. However, science is teaching us that there is, in fact, a variety of modifiable risk factors. So these are factors that relate to lifestyle, to overall health management, education, general other conditions that do in fact impact our risk. And so there is a degree of modification or control. We are able to minimize our risk. We're certainly able to improve our overall resiliency. And you can see here that research is looking at formal education, links with traumatic brain injuries, lots of lifestyle factors to do with diet, with physical activity, with sleep, with cognitive and social engagement. We're looking more at the relationship between brain health and heart health, so cardiovascular health, all things to consider. Caveats, of course, when we're talking about modifiable risk factors, is the variety of reasons that may be unique to one person and not another person, and much more studies now looking at the linking of social determinants and how social determinants of health may impact some or all of these factors. So, Alzheimer's is in fact a public health crisis, and there is much more work being done in our public health space to raise awareness, to broaden available research, to increase and support that infrastructure. Next slide, please. In addition to our care and support and education work, the association's work includes supporting and leading global research, and it is phenomenally exciting to look at some of the investments. So currently, across the globe, the association's got $430 million invested in over 1,000 projects in 56 countries. And of course, part of our work is to support the big, well-established scientists and clinicians and projects, but it's also to fund that seed work. So the newer, the younger clinicians, we want to help them grow in their expertise. We want to connect them to each other. We want to create a very collaborative global research culture to advance the understanding of the disease and the progression towards a cure. For many of us, maybe on this webinar who are in North Carolina, I always say that North Carolina is an extremely exciting state to live in terms of research and support services. Since 1993, the association has invested almost $94 million in research in North Carolina. And of course, to Duke University, to Wake Forest, to UNC, to Eastern University of North Carolina, ECU as well. North Carolina is also headquarters and home to the U.S. Pointer Study, which is a first of its kind lifestyle intervention study in the United States, and that is led by the association and Wake Forest. The North Carolina site has closed its 2 to 3 year study. There are 4 other sites across the country that in the next year or 2 or 3 will be wrapping up their studies. So we hope to see data being shared earliest at the 2025 Alzheimer's Association International Conference. Next slide, please. Critical to how research has advanced Alzheimer's disease treatments. The disease was first described by Dr. Alois Alzheimer's in 1906, if you can imagine, and he identified what we've come to know as the hallmarks of Alzheimer's disease, or what we call the plaques and the tangles that grow in the brain. And these plaques and these tangles are actually related to the amyloid and the tau proteins that build up in the brain and cause damage to our neuron and cellular structure, therefore causing those dementia symptoms and the disease. Since 1996 in the United States, we have had a variety of medications available. These medications do not alter the underlying biology of the disease. they do treat the cognitive symptoms of the disease. And many of us may be familiar with Aricept, Exelon, Namenda. There was recently another FDA-approved medication for agitation related to Alzheimer's disease. Some of these medications are more effective in the earlier stages. They can actually act like a vitamin to strengthen the neural pathways and communication. Some of these medications are more effective in the middle stages of the disease to help, again, mitigate some of the behaviors that frequently come with Alzheimer's disease. 2021 was an absolute banner year in the advent of an entirely new class of medications. And in 2021, Aduhelm, if you may remember, a bit controversial, came through FDA very limited Federal Drug Administration approvals. So it was only available in clinical trials. The Centers for Medicare and Medicaid did not cover it. Aduhelm has since been taken off the market. But then Leqembi came through with full FDA approval with Veterans Administration and CMS coverage, which also means that many of the major private insurers will cover it. And so Leqembi was much more accessible for individuals. And then most recently, Kinsula, I'm still trying to learn to pronounce the market name of that, but in clinical trials, it was known as Donanemab. That has received full FDA approval. CMS is covering that, the VA is covering that, and so many, but not all, private insurers are covering Kinsula. Next slide, please. What is different about these treatments, they are part of a family called anti-amyloid monoclonal antibodies. And what that really means is they are the very first treatments of their kind that address that underlying biology of the disease. They slow down the progression of the disease, not cure it, but slow it down significantly. And they do so because they're targeting and reducing the buildup of that amyloid plaque in the brain. So, in clinical trials and now in practice, these treatments are most effective for individuals with mild cognitive impairment due to Alzheimer's disease or in the very early stages of Alzheimer's disease. Again, for those that have amyloid in the brain. And this is part of the reason why early detection and early diagnosis are so important for individuals. The earlier we detect and diagnose this disease, the more individuals are open to clinical trials as well as these new treatments. Currently, these treatments are only available in an infusion capacity, which means that they have to be administered and they have to be administered in a hospital or a clinical setting that does infusions. Leqembi, I believe, is every 2 weeks. But certainly in the pipeline, researchers are looking at the ability for individuals to self-administer, much like a diabetic is able to self-administer insulin. So that will be a reality that is under development. Next slide, please. We often get asked about the risk of diabetes and the connection between diabetes and Alzheimer's. And the Alzheimer's Association does not have a position on that relationship. There are, however, researchers that are looking at kind of what they're calling a type 3 diabetes. And they are identifying that as, when the neurons in the brain cannot respond to the insulin, causing an insulin deficiency, causing cognitive decline in the brain. So while we are not entirely clear on that relationship, it certainly occupies some of research space. And we do know that diabetes is among those health conditions that put individuals at higher risk. Next slide, please. I mentioned earlier the 2024 Alzheimer's Facts and Figures report. In every annual report, we have a special focus. In 2024, that focus was mapping a better future for dementia care navigation. And so it looked at survey results from caregivers who identified points of stress in the journey, gaps in the journey, looked at surveys of healthcare workers who the majority identified, our healthcare system is lacking in coordinated dementia care. And then it really looked at and proposed ways to address that and some of the highlight initiatives that are happening in our country. So if we'll go to the next slide. The report itself presents this terrific visual of the current state of dementia care in our country. And so, while of course there are supports available, there's clinical care available, by and large, there is no central clear path for an individual worried, seeking a diagnosis, or having received a diagnosis. There are many services out there. They overlap at key points, but it is disjointed, it is disconnected. There is no navigation throughout this that's provided. There is an emerging profession of care navigators that individuals, families can hire for private pay to help them navigate this, but there's nothing built into our health system. And in addition, a unique challenge, as we all know, of this disease is that, yes, there are medical issues, concerns, and needs, but there are also non-medical or social. So there is that private duty care that individuals need, care with assistance with daily, activities of daily living. There's companionship care, there's support for the caregiver that are not traditional under our medical umbrella. So often that's scattered in multiple directions, hard for caregivers to access, many times hard for caregivers to pay for. If we look at the next slide, what the report also proposes is what might the ideal future state of dementia care look like. And caveat, of course, here that no journey for care, no progression through a disease is necessarily linear, nor does it look the same for every individual and family. So remember, you've met one family with Alzheimer's, you've met one family with Alzheimer's. But the ideal model proposes a much cleaner pathway to improved outcomes. And really, what is central to this model is that care navigation is built into it. So individuals and families have a navigator who is bringing them through this journey based on what they need. Person-centered care, guided by navigation that marries or weds the medical and the non-medical. And so what are we doing to try to get here? Well, a very exciting initiative that launched this year is the GUIDE model that is guiding an improved dementia care experience. This is a Center for Medicare Medicaid 8-year pilot that has been awarded to a variety of health systems and providers across the country, at least 50% of which serve underserved populations or are in areas that are underserved, not wealthy, typically systems that have not had resources. And what the GUIDE model is exploring is an alternative payment methodology. So moving away from our traditional fee for service, much more of an umbrella model that will then allow a system and a provider to tailor care to the particular needs of the family. This model also adds in care navigation and includes that combination of the medical and the social care. And all of this information is publicly accessible. If you'd like to dive deeper into it, you can visit cms.gov or again, the Alzheimer's Association website, alz.com, and simply search for guide in capital letters. And if we could go to the next slide. Looks like we are wrapping up, but before I talk a little bit about resources that are available, did also want to mention another opportunity, underneath the umbrella of improving the caregiver experience, resources to the caregiver, access for support to the caregiver. The Alzheimer's Association received a grant from the Administration for Community Living, which is a division of our United States Department of Health and Human Services. This grant was to establish the Center for Dementia Respite Innovation. We are partnering with the University of Minnesota School of Public Health and USA Aging. This grant program also kicked off this past summer, and it is a 5 year, so over 5 years, the Center for Dementia Respite Innovation will award. Each year there will be a grant cycle. Each grant is for approximately 2 years, and $20 million will be awarded to local respite care providers who are looking to broaden or enhance their existing respite offerings. 50% of those grant awards will target, again, providers that are serving underserved communities. So very, very excited that that is now also a part of our work, is to improve the infrastructure of respite care for caregivers. Some of the other resources and support that the Alzheimer's Association offers, and this is to all individuals, of course, is our helpline. That's available 24/7 in up to 200 languages, providing free services. So that's information and referral, or also care consultations. If a family is facing a diagnosis or recognizing a transition, if they are working with caring.com or one of you on a transition and they need a little bit of an extra tender loving care, or an action plan, or a venting in a crisis one night, that is all available through helpline. There are a myriad of resources online at alz.org. You can deep dive into care, which will be general care and support. Our safety center looks particularly at environmental and safety issues, has a number of great home safety checklists. So if you're working with families that have their loved one at home, terrific guidance on, easy adjustments we can make in our environment to maximize independence and safety. There is also a driving center with a lot of resources for families earlier in the disease that are still working with a loved one who's driving. ALZ Connect is a community, an online community for caregivers. ALZ Navigator is that kind of an input, confidential, developing a care plan for your family. Through local chapters, our website, or the Community Resource Finder, individuals can connect to local resources. So if you are in fact a provider, whether you are placement or home health or a care community, you can go to Community Resource Finder online. When you access that, you'll see it's a partnership between AARP and the Alzheimer's Association. There is a link in the upper right-hand corner for providers. This site is administered by a third party, but you can work through that provider link to actually upload the information about your agency, your care community, your services. And therefore, when individuals go to this site, they can search by category, they can search by geography for a variety of services. And that is free, again, to providers. And then we have awareness education programs that are in person in communities across the country, online, on demand, and virtually. We have many partners like caring.com. We come together to host educational programs. So that was a high level kind of exploration and look at, where we are currently with prevalence, where the research has brought us. Lots more to talk about. Want to open some time for any questions or comments, Jess, and then I have certainly some other developments that are in the pipeline that we can share.
Yeah, absolutely. Thank you so much for all of this helpful information. We already have several questions in the queue. One is actually asking you about the information you just shared about AARP and that resource or the community resource finder. Why don't we say that after this, we'll write down those instructions and I can include it in the email going out, and that way anyone who wants it can find it that way, just in case other folks are wanting to share that.
Absolutely. And if I could just kind of add to that, we'll send the link out, communityresourcefinder.org, I believe, but we will verify that. It is a public facing database where individuals can search AARP or the association by a category of resource and also their own geography. So, how far are they willing to travel, for example? Are they looking for a support group? It is also, there is an internal facing component of that database. So if an individual calls our helpline, for example, and is asking about local resources, care communities maybe, or in-home health, if the provider has entered themselves into the community resource finder, our care consultants are going to be able to find that. And then they share a list of those local resources with the callers.
Okay, great. There are several questions about the grant process for, let's see, service innovation locally on Alzheimer's care, and then applying for grants to expand services to Alzheimer's clients that can't afford private care hours. Where can folks apply for that or get more information on those grants?
Okay, so again, wonderful question with regard to the Center for Dementia Respite Innovation. That 5-year program is grant funding to agencies, not directly to individuals. So
Mhm.
agencies and organizations who are providing some type of respite care, formal or informal, they are looking for monetary and consultative support to enhance or expand those respite resources, can apply for those grants. And that support, again, it's both monetary, but it's also consultative, it's IT support. They are extremely competitive. I think this year 20 grants were awarded across the
Mhm.
country. We will send the link out. You can Google Center for Dementia Respite Innovation, and what you should see is the one that pops up tied to Alzheimer's Association. Again, I will make sure Jess has that proper link that will take you to the website that gives you overall information. And on the website, it also lets you know who to contact to discuss the process, what that might look like if you are eligible. For support directly to individual caregivers, then I would absolutely refer back to, in North Carolina, I would refer back to your local Council on Aging, or your AAA Area Agency on Aging, or your Project Cares. And increasing funding in North Carolina, at least, increasing funding to Project Cares is one of the state priorities right now for the association and for kind of the Dementia Coalition. So, um, Project Cares does award financial support directly to caregivers to use for respite care or in-home care. And then your AAAs, your Council on Aging, your Council on Governments would very likely know of other financial resources directly for caregivers.
And thank you. Switching gears a little bit, questions about the disease itself. How is Alzheimer's diagnosed, whether it be labs, MRIs, that sort of like what's the most common process? I know you mentioned that there is no linear path right now, but what are some of the most common ways that that diagnosis is identified for folks?
That is a wonderful question. And again, Jess, I've got a great handout that talks a little more in detail, but it is in fact a process. So, at this point in time, there is no one single diagnostic tool. It's going to be a combination largely of, starting out with just your medical history and physical. So where, the standard where an individual is at this moment in time. What is their medical history? What are their risk factors? What are the types of signs or symptoms that they may be exhibiting? So that's going to be an initial component. And then, at the level of primary care physician, it's going to differ vastly how far a primary care physician is going to go in the process or at what point they will refer to a neurologist. There are a whole series of, we might call them mini mental or cognitive tests that primary care physicians can do. For individuals now, on Medicare now, part of the annual wellness test includes a cognitive component. And so I very, very strongly encourage, if you're working with families, that, you know, that's a much more gentle way to introduce. Let's start talking about cognitive health. So as part of their annual wellness, individuals can get that cognitive assessment. It is not it's less a test of performance and it's more a test of ability at a certain moment in time. So by doing it right out of the gate, and then repeating it every year, you can see changes, where the brain and where ability may be changing. So that's also going to be a component of it. And then there is a psychological neuropsychological component to assessment. So if that primary care physician is not able to diagnose another condition that could be causing those symptoms, if they feel the need to then elevate, they're going to elevate to neurology, to psychology, to psychiatry, and there will be a battery again of diagnostic tools that are brought to bear. Very important to talk with the doctor when you begin the diagnostic process because there are tests and tools that neurologists can use that they can code under Medicare that are covered, but primary care physicians cannot. So
Okay.
there are tests that you could get billed extravagantly for if your primary care physician orders them, but if your neurologist orders them, Medicare will cover them. So
Hmm.
important to understand. So again, it's going to be history and physical. It's going to be mental health screenings. It's going to be a psychiatric component, and then there's going to be a neurology component. In the pipeline, really, really exciting are blood tests for
Okay.
Alzheimer's. So right now, there are researchers and scientists looking at blood tests. There are blood tests that are being used in clinical trials. Blood tests are being shown in clinical trials to have a much higher efficacy rating than a lot of these other diagnostic tools. At this point, the FDA hasn't approved any one single blood test. They've not set any guidelines for which tests providers should be using. So while there may be providers out there incorporating blood tests, again, you've got to look at um, if the FDA hasn't yet kind of endorsed this and attached guidelines to this, CMS certainly is not paying for it. Medicare is not paying for it, nor is insurance. But the reality of a blood test as part of the diagnostic process is far closer than it's ever been. And that will help certainly advance the timing in which we can diagnose Alzheimer's.
Sure. That's awesome to hear. Someone's asking, is there a way to find out what Medicare tends to approve for testing or a resource about that type of information that they can share with families?
That's a terrific question, and it will probably differ if you're talking traditional Medicare or if you're talking a Medicare Advantage plan.
Sure.
Um, so I think it would be important to reach out to the specific plan to find out how they're structured and what they're covered, or a SHIP counselor. So those benefits counselors that are often during the open enrollment season, they are often available at senior centers, at other agencies, at no cost to help individuals who are re-upping. You could tap into them. They would
Yep.
probably be very willing to come and talk about what are the differences between these plans and what are the types of questions to really understand coverage. A
Yeah.
Humana might be different than a Blue Cross, might be different than
Sure.
an AARP. So,
Yep.
um, you could go to the CMS.gov website, but then I would take whatever you are reading there and reach out to an insurance counselor, to a SHIP
Sure.
counselor, or to folks that work privately in that space.
Yeah, that's great advice. We at Caring, we've been updating a ton of our content around memory care in honor of Alzheimer's awareness this month. And so that's definitely something as well for those asking these questions. That's something we can also dive into on your behalf. And so I've made a note of that in hopes of maybe
Great.
doing some of that work for you.
That would
Um,
be a great webinar topic,
yeah.
just a deep dive into understanding that. And then, in addition to what it covers, the pharmacy component of that too, the
Mm,
DPs.
absolutely. Yeah, that's a great point. When talking about education, you were mentioning the counselors and the different folks. What should folks do if they are interested in bringing an education program to their workplace or the care community or any of the civic organizations they might be involved in? And when thinking about all that the Alzheimer's Association has to offer, and is there a cost associated with that?
I love that question because that is absolutely that's the space that we work in with our partners. So the Alzheimer's Association has a set of core common education programs, ranges from what I would call our gateway programs. So, the 10 warning signs of Alzheimer's, for example, which looks at, you know, what what changes do we experience as we age? What are typical changes? What's the difference between losing something and that's normal versus, a red flag that there may be cognitive impairment. We've
Mm,
got understanding Alzheimer's and dementia, which is really a deep dive into the disease. We've got specialty topics on brain health, healthy living, financial management for caregivers. So those individuals who are suddenly thrust into a role where they're responsible for somebody else's finances, and what can help them. And then we've got, very caregiver centric education and awareness. So quite a variety of programs, all of which are free to the general public. That work is supported through fundraisers like the Walk that you all may have heard of. Best way to reach us, a couple of different options. You can call helpline and let them know where you are, and they will very happily connect you directly to your local chapter. You can also go out onto the website alz.org and look for your local chapter. So, for example, find your chapter if you're in North Carolina. You click on North Carolina, it's going to give you Western, it's going to give you Eastern. We kind of divide the state, and it should give you a website. Easiest way I say would be call an helpline and just say, I am in this
okay.
part of the country. I really want to talk to somebody at the chapter about an education program. They will make that connection. We will reach out to you. All of our education programs can really be tailored and customized to the audience. They can also be tied to other programs. So very often, we may partner with a caring.com, we may partner with an elder lawyer. So we're bringing in general education, and then we've got a specialty person. We can talk about finances, and we can bring in the insurance folks to talk about that piece of it.
Sure.
So 1-800 or alz.org. All of these programs are free. We can do them virtually. We can do them in person. They can be tailored to families, to your Rotaries, to your 4-H clubs, um, to your staff if you wish. And they
Sure.
can also be tailored in time, 30 minutes, 60 minutes, longer than that.
Sure. Is that when talking about the helpline and then the local chapters, is that also for those of us interested in getting more involved with the association, is that the best way to find out how to get more involved or volunteer, for example?
Again, helpline would be great if you're looking at ways to plug in. They can connect you to your local chapter. We also have a link, not sure, Jess, if you're able to get it in the chat or it will be in the follow-up. We have a website for volunteering at the association. So it's alz.org/volunteer. And visiting that site will give you a really high level picture of the many different opportunities. We are a volunteer powered organization. We are a partnership powered organization. So, always looking for agencies and individuals who want to build a relationship, full mission across the many pillars, or maybe in a particular area. There are day of opportunities, event opportunities, opportunities to sit on leadership boards. There are advocacy opportunities that take 5 minutes a month, or you can really engage at the state and federal level. And then there are the care and support opportunities, becoming a community educator, delivering our
Mhm.
programs, becoming a support group facilitator. So I would start with that website to get a big picture. And then, depending upon what kind of tweaks you reach out to the local chapter, you can connect. We will send you, of course, North Carolina links, but you can connect through Helpline. Let them know, you're interested in volunteering and want to talk to somebody at a local chapter and where you live. And then they can talk, a little bit more detailed about what that looks like in a particular area. We welcome all sorts of inquiries on partnering. The mission is to raise awareness. It is to do what we're doing today and connect caregivers to resources and to educate folks and to do a lot of advocacy as well at the
Mhm.
state and federal level.
Awesome. Let's see. Um, Someone's asking, going back to the grant question, are there, I know we talked about a couple of different ones. Is there a grant that folks, this is a supervisor from a caregiving agency, are there grants that they can share with clients who have financial struggles, or is that something separate?
That is where I would refer back when you are seeking to help the family directly, so be able to direct the family to sources of funding. Best bet there is going to be your local community or your local county, your council on aging, council on government, area agency on aging, or project cares. And if you are in the state of North Carolina, you can call 211 and let them know you are an agency and you're just looking to compile what are those local resources for families that are in need of funding for care.
Hmm,
And they will be able to tie you directly to that kind of support.
perfect. All right, that is all the questions that we have or that I've received so far. If I receive more, in the next little bit, I'll be sure to reach out and include any information in the follow-up. I want to reiterate to everyone who is on, there are so many resources coming in the email that we'll be sending out, including the recording and the slides here. So thank you all so much for joining. We at Caring, of course, welcome your feedback on today's presentation. And if there's any topics you'd like us to dive into in the future, we are in 2025 planning. We'd love to hear them. There will be a survey that pops up as the webinar closes. So we would love to hear from you. You can also contact us via the phone number and emails. And to stay on top of our upcoming trainings, I encourage you to follow us on LinkedIn, as well as visit our industry website, which is partners.caring.com. And of course, all of the incredible Alzheimer's Association links and resources will be shared with you as well. We hope that you have an incredible rest of your day. This is our last webinar of 2024. And so we wish you an incredible end to the year in all of the work that you do of helping seniors. And we hope you have a great rest of the day. So thank you all so much and have a great day.
Thank you. Thank you, everybody.